Hello, Waste Watch this week is going to be looking at NHS waste. So we've come along to our local hospital in Chertsey to pick up some of the latest stories. Let's start with the story this week that NHS hospitals are spending £300 million a year to hire some very expensive temporary staff. That's to cover shortages among their permanent staff. And a German GP was flown 500 miles to Scotland and back to work just 2 5-hour shifts at a cost of £100 an hour. Now, after putting all that money in, you may be asking why there are staff shortages. The answer to that, of course, is that cash-strapped hospital trusts are being forced to cut the number of permanent posts. Informed sources put the number of cuts at 20,000 posts, and that costs money. The NHS this year will be shelling out an estimated £325 million on redundancy payments. So what that means for taxpayers is that we are now in the extraordinary situation where we are spending £325 million to make permanent staff redundant, and then spending another £300 million to hire temporary staff to cover for them. So just how is it that we can double the amount of money we're spending on the NHS, and yet our hospitals are in such a financial crisis that they're having to make staff cuts? The simple and scandalous reality is that a large chunk of that additional £40 billion has been wasted. According to the authoritative King's Fund, fully 80% of the additional money has gone on cost increases and not on improvements in NHS services. By now, most of us are only too familiar with the sad catalogue of NHS waste. Let's take that notorious NHS supercomputer. That was originated at a top-level summit chaired by Tony Blair at 10 Downing Street and was originally supposed to cost £6 billion. Well, actually, the original figure they mentioned was £2 billion. But in any event, the National Audit Office during the summer in its report said the cost had escalated to £12 billion. Lord Warner, the health minister, who ought to know, blurted out that the cost was actually around £20 billion, and industry insiders reckon it could cost us up to £50 billion. And yet the thing is, many of the medical staff that are supposed to use the thing, including most of our GPs, don't actually want it. Or take those PFI hospitals. In theory, they could be a very good deal for taxpayers, but in practice, they've turned out to be anything but. A recent analysis of 83 PFI hospital projects said that the value of the buildings was around £8 billion, but the total cost to taxpayers over the long-term contracts involved was an extraordinary £53 billion. The NHS also seems to pay far too much for its pharmaceutical supplies. A recent report said that the NHS pays over £1 billion more for branded drugs than its equivalent purchasers in continental Europe. Or take the cost of the new pay deals for NHS staff. Many NHS staff have done very well out of it, and good luck to them. The average GP salary is now north of £100,000. But the Department of Health, in negotiating that deal, gave away all that money and got nothing in return. In fact, if you take GPs as an example, we tax-paying consumers have actually got a worse deal because we've lost Saturday morning surgeries and we've lost our traditional out-of-hours service. So what are NHS managers doing about this? Well, the first thing is they're hiring more management consultants, many more management consultants. The Department of Health itself has just spent over £130 million on consultants, and health service trusts have spent over £170 billion. Perhaps the most ludicrous example is the Department of Health's insistence that NHS trusts that are in deficit have to hire outside consultants to tell them what to do. That's costing them £22 million a year. But the other and far scarier thing that the Department of Health is doing is reducing the standard of service to us, the paying customers. For example, a recent departmental report suggested that cash-strapped hospital trusts could save money by cutting out, quote, unnecessary surgical procedures, unquote. Frankly, I'd rather the doctors decided that rather than some NHS bureaucrat. Of course, the other good way of saving money is to close hospitals altogether. And if reports in our local press are to be believed, this, our local hospital, will be on the casualty list. But then you see, we live in a blue constituency, and according to reports of that notorious heat map that Patricia Hewitt is using to decide which hospitals to close, then our hospital will close and the hospitals in Labour constituencies will be preserved. But you know what? This isn't really a party political point at all. I think if the political boot were on the other foot, it would be hospitals in Labour constituencies closing. No, the real problem here is that we have got our politicians far too involved in our healthcare.